Welcome to Risk Roundup. Humanity is at crossroads. The coronavirus, COVID-19, that emerged in Wuhan, China, is now a full-blown pandemic spread across nations. So as I begin to evaluate why are we as a species so vulnerable to infectious diseases, I not only learned a lot, but I came across passionate professionals who, like me, are looking for answers to the ongoing crisis. We at Risk Group are committed to bring you all our analysis. The first in our COVID-19 analysis is to evaluate the role of vitamin C. The reason is we found that there has been large series of animal studies over the years that has concluded that vitamin C plays a role in preventing, shortening, and alleviating diverse viral infections. Reports are emerging that vitamin C has similar effects in humans. Many control studies have shown that vitamin C shortens and alleviates the common cold, flu, and pneumonia. In fact, 5 controlled trials found significant effects of vitamin C against pneumonia. While the practical importance and optimally efficacious doses of vitamin C for preventing and treating infections are not clearly known, new data sets are emerging from Wuhan, China, the epicenter of the coronavirus outbreak, which sheds new light to the role vitamin C can play in the current crisis. To discuss the role vitamin C could play in preventing and treating COVID-19 infections, I'm delighted to welcome Dr. Richard Cheng, MD, Ph.D. to Risk Roundup. Dr. Cheng is the founder and director of Dr. Cheng Integrative Health Center, and he has served in the United States Army as a commissioned officer, major, and as an Army physician. While in the Army, Dr. Cheng served in various positions, including Chief and Medical Director of Pathology and Laboratory Medicine, member of Risk Management Committee, Credential Committee, and Staff Physician of Soldier Readiness Program, consultant to the Shaw Air Force Base Laboratory, and College of American Pathologists Inspection Team Leader for the Greenville Hospital Lab Inspection. Welcome, Dr. Cheng. We are so very honored to have you on this roundup.
Well, thank you for having me.
Wonderful, Dr. Cheng. So, in the early 1900s, Casimir Funk, who coined the word vitamin, noted that an epidemic of pneumonia in the Sudan disappeared when anti-scorbutic vitamin C containing treatment was given to the numerous cases of scurvy that appeared at about the same time. So as we witness the Wuhan virus, which is now known as COVID-19 coronavirus, wreak havoc in not only China, but Iran, Italy, Europe, and is aggressively spreading in the United States and across nations. So it seems you have a story to tell that resembles somewhat to the 1900s. Can you share what you learned in Wuhan?
Okay, well, actually, I came from the United States to Shanghai about in early part of January, planning on to celebrate Chinese New Year and with my parents and to attend a few meetings. And what I didn't realize was that shortly after, about 10 days after I landed in Shanghai, the COVID-19 epidemic broke out, and now it turned into a pandemic, a global pandemic. And so as that rapidly developed, and because of the, I have been very interested and studying and using vitamin C on myself, on my family members, and also on my patients for quite a few years. So I instantly know vitamin C is a universal, powerful antimicrobial. That includes antivirus. Vitamin C has a lot of effects. Here today, we're going to talk mostly on the antivirus effect. So I started immediately, and also over the last couple of years, I've been coming back to China visiting. I came from Shanghai 30-some years ago. I went to United States then. And so I made some acquaintances in the academic and public official hospitals, people here. So I united with a few open-minded physicians who know about vitamin C, who've been using high-dose vitamin C here. We formed an international high-dose vitamin C medical support group that includes physicians from China, from US, from Japan, and from Europe. And so we've been calling for vitamin C use in this epidemic. Why? For one major reason, because we didn't have, and we still don't have, any better treatments for COVID-19, okay? For one thing, there's no better treatment out there. All there is, so far mostly, is supportive care, which is very important. And then we knew vitamin C is effective? And like as you in your opening statement, you mentioned about the long history of vitamin C treatments. Let me just mention briefly to you. Vitamin C has been tried in used in many infections. Okay, we're going to only talk about infections. As a matter of fact, in the largest medical library in the world, the PubMed, I'm sure you know, which is the medical library by U.S. Congress, actually hosted in the NIH. In PubMed, there are over 65,000 research articles. These are all peer-reviewed journal articles, not including other articles. And I am not aware of any other biomedical molecule that has more research than vitamin C. Okay, if vitamin C is not the most studied, at least it is one of the most studied molecules. Today, when you ask doctors, a lot of other people, they may say, oh, we don't have enough research on vitamin C. Well, my answer is purely you have not done your homework. There's tons of research. There are a couple of books which will summarize this type of research. I like to quote one, which I translated into Chinese and published because I feel this is so important. This one book is title is Primal Panacea by Thomas Levy. Many of you probably know his name, Thomas Levy, L-E-V-Y. Well, in that book, and also he published another Cure the Incurable. Basically, he listed the literature reports, studies of vitamin C. Vitamin C has been used to treat, just name a few, hepatitis, AIDS, tuberculosis. Let me quote one research paper back in the 1940s. I think it was 1949. I think it was Dr. Kleiner reported using vitamin C to treat 60 polio patients. Remember, this is before the polio vaccine came out. And he successfully, this is reported in the Southern Medical Journal, and he successfully treated 60 polio patients and 100% healed without sequelae, without consequences, no paralysis. 60 out of 60. But people didn't pay attention. Well, because people were all paying attention to vaccines. Okay, I may be going through a little bit. Okay, but basically, yes, we like to have a vaccine for COVID-19, but let's understand, it takes a long time to research and develop a vaccine. Okay, I think my numbers are right, that Congress just authorized $8.7 billion for COVID-19, and President Trump allotted, I think, $3.1 billion to vaccine research and development, which is 37% of the $8.7 billion US dollars. Now, yes, vaccine is important. Again, anti-COVID-19 virus specific drugs are important. However, the R&D of these drugs takes a long time. Now, vaccine, let me rephrase that. It takes an average probably at least 2-3 years for a marketable vaccine. And remember, COVID-19 is a global pandemic. We have 7 billion people worldwide. Now, if we want to stop a pandemic, we need to vaccine. We will have to vaccinate probably, I'm not an epidemiologist, but according to what came out of UK, right, this mass immunity thing. So I saw some number like 60% of the population need to be immune to this disease, right? So we need probably roughly 60% of the 7 billion people to be vaccinated. That's what? That's more than 4 billion. We're talking about 4 billion, I don't know, at least 4 billion doses. How much of a manufacturing facility do we need to manufacture that many doses for 4 billion people? 4 billion people. So anyway, my point is that vaccines for COVID-19 will not be here for another long time. Now, if the COVID-19 pandemic is not under control for that much long time, I'm not sure vaccine will be of any use, even if one came out at that late. So the point is very clear here, is that vaccines are of no immediate use for us right now. We wish we had it, but we don't, and don't expect anytime soon. So vaccines are out of the picture right now. So what else do we have? We don't have any antiviral specific drugs for this particular COVID-19. Again, it's the same like a vaccine. It's specific. It takes time to develop. So what we have is just, what have we available to us other than supportive measures is we have to learn from a lesson. And we know vitamin C has a very universal, again, it's universal, it's general, it's not any particular virus. Why is that? It's because vitamin C is part of the natural defense system of the animal kingdom. Yes.
Speaking of that,
yeah.
I mean,
Yes.
when we evaluate, like you said, it is the defense mechanism. So
yeah,
when we evaluate all these pandemics that have happened all across, over the years, we notice that most of them has been based on viruses. Only few
yes.
were related with bacteria. So what does that mean, that we all have become deficient in vitamin C? Why are humans so susceptible to virus infections?
That's a very important question, actually. Let me bring this up a little bit. Actually, this goes back to here. There are conceptual problems here. Okay, now let's touch up on this a little bit. First of all, the current medicine considers every disease as a separate disease. For example, this COVID-19 infection, we consider it as a unique COVID-19 viral infection. And we do not draw parallel relationship of this to others. But if you really look at the biochemical level of all diseases, or at least infectious diseases, biochemically, actually, it is simply a redox reaction. It's basically the electrons movement, okay? And basically what happens here is a virus infection as an oxidizing agent. It goes into cells, it causes biochemical imbalance. It removes the electrons, it grabs the electrons in the environment, renders other biomolecules inactive. Okay, that's the fundamental feature of nearly all pathogens at the biochemical level. This may be a little bit hard to imagine, but we human bodies, we are actually electrical organ. Okay, we are electrical body.
Yes.
We humans are alive because our heart beats, our brain works. Why? Because we do EKGs and EEGs, right? So all life matter is electricity. We know electricity, the electron moving around. And if that normal smooth electron flow stops or interfered by some extra unnecessary abnormal substance, then our normal life will be impaired. If it's mild, we can restore it. If it's very severe, it stops and then we'll be killed. So with that in our mind, so it comes back to the ultimately this oxidizing and reduction series. Okay, and vitamin C is a prototypical antioxidant. Of course, vitamin C is not the only antioxidant, but it's the prototypical. It's a small molecule. It's a water soluble, so it goes everywhere. Vitamin C it exchanges with the biggest intracellular antioxidant, the glutathione system. So these antioxidants help each other by reduce the state of our normal biomolecules in the body. And you mentioned it earlier. Why it sounds like everybody's deficient in vitamin C? Yes, it is true. Why is that? It's because, again, it's about the redox issue. Today, we have so much more oxidizing agents in our environment, right? We have so many these chemicals, these agricultural chemicals, these antibiotics, hormones, or these drugs, chemicals, plastics, everything. These are mostly oxidizing agents. They need extra antioxidants to neutralize. That's one factor. And don't forget the EMFs, electromagnetic fields. These EMFs are also oxidizing agents. They require, I mean, X-ray, for example. We can study X-ray easily. Radiation. Radiation oxidizes, mutates our DNA. Everybody knows that. Well, because it's oxidizing. It oxidizes our DNA. Okay, so EMF.
This man-made electromagnetic spectrum, you think that has also added to why human body has become so deficient in vitamin C?
Yes, it helps. Basically, it's to the, hold on a second, I'm sorry, my actually, that's my alarm I set for your interview today. And yes, it is basically works to the total oxidizing capacity versus the antioxidant capacity, okay? And on the other hand, on the one hand, we have an increased increased oxidant load to our body. On the other hand, today, I don't know, you look very young, but I'm of that age, when I was young, I had I had foods on my table. Basically, my parents would go out to the market and buy it fresh in the morning and cook it the same day. And also at that time, hopefully, probably didn't have that much agricultural, product, fertilizers, pesticides, that kind of thing. So today, actually, we have a reduced intake of antioxidants. Think about how much vegetables or these vitamin C or vitamin-containing foods we eat compared to before. People today eat a lot more processed foods. And we know, for example, vitamin C degrades quickly in these canned foods or prepared foods. We don't eat nearly as much as before. And also because of agricultural practice, we probably know, mostly we know the food and nutrition value of the foods today is also not as high as used to be. So that's how it works. It's basically we have increasing oxidant load and decreasing antioxidant load, so causing an overall increased oxidative stress or increased extra free radicals. Give you one example. Everybody knows about fish oil, right? A lot of people are taking fish oil. Fish oil, we're talking about mostly omega-3. And we know there's omega-6 and omega-9. So taking omega-3 and omega-6 as an example, we know omega-3 is antioxidant. And we know anti-inflammatory. We know omega-6 is more like a pro-inflammatory. Well, of course, both are important. Normally, we believe we need a 1-to-1 ratio, basically 1 molecule of omega-3 and versus 1 molecule of omega-6. But in reality, in the United States, among Americans, it is estimated the ratio of omega-3 to omega-6 is at least 1-to-18. There are research reports showing maybe even higher, meaning the pro-inflammatory omega-6 is at least 18 times more than omega-3. That's part of the reason why this, well, of course, we're diverging a little bit. Basically, most, if not all, chronic diseases actually are inflammatory in nature. We already know, like, for example, heart disease, coronary artery disease, diabetes, metabolic syndrome. These are all inflammatory diseases in nature. And omega, why? Because we have too many pro-inflammatory factors in our life. We don't have nearly enough of the anti-inflammatory nature. I mean, autoimmune disease, the frequency has really increased. This is all tied into the same picture. Here brings a very important, it's a paradigm difference here, is that in our mainstream medicine right now is we think of every disease as a separate disease. But in the integrative or functional medicine field, we begin to look deeper, look at more of a root causes. Actually, so all of diseases are primarily symptomatic manifestations. They are pathogenesis, their pathways, their biochemical mechanism are very similar. Mostly it is this our body interacting with the environment, and the environment is heavily polluted.
Yes, yes. No, I
And
agree.
that's the
Even if we,
yeah
let's discuss biology, because relevant to
yeah
the impacts of vitamin C on infections, that is also very important to understand the biology, because evidence-based medicine,
yeah
mainstream medicine, like you're talking, emphasizes that in the evaluation of treatment, researchers should focus primarily on clinically relevant outcomes, and little weight should be put on biological explanation. Therefore, if we look at all the available research, it focuses on infections and not on the immune system. So, do we understand the role vitamin C plays on our immune system? Because, like you said, we don't have an integrated approach. We just look at, bits and pieces. We are not looking at the overall, and we are not focusing on the root causes. So, if we look at the root causes of our, immune system, do you see
yes
vitamin
uh,
C plays a role in that?
yes. So but yeah, actually, to answer your question directly, there are several lines of evidence to support vitamin C's effectiveness in antiviral capacity. Number one, vitamin C in our body increases the production of hydrogen peroxide. This is well established in the literature. Nobody can say no to this. We know for sure. Basically, vitamin C in our cells, in our body, via so-called a Fenton reaction. Basically, it's a series of several reactions in the presence of like ion type of metal. It, it produces hydrogen peroxide. And we know hydrogen peroxide is antimicrobial. We use hydrogen peroxide. Hydrogen peroxide kills virus, kills bacteria. Actually, it kills cancer cells too. It's part of the main mechanism in high dose vitamin C in cancer treatment. So yes, this is the direct effect of vitamin C on killing virus. But this usually requires a higher dose. And the vitamin C,
Talking about
yes,
doses, sorry to interrupt. I mean, if you look at the dose concentration relationship of vitamin C, it seems that vitamin C level in plasma of people in good health becomes saturated at about 70 micromole per liter when the intake is about zero point 0.2 gram per day. Now, on the other hand, when vitamin C intake is below zero point 0.1 gram per day, there is a steep relationship between plasma vitamin C level and the dose of the vitamin. So, is there any data available from Wuhan which can give us insight into the vitamin C level of the infected people?
no, we don't have that, but we can learn from the others. We know actually, to answer your question first, most of the chronic diseases where studies have been done show a severe vitamin C deficiency. This includes this includes cancer, diabetes, coronary heart disease. Okay, if you research that, and I have no doubt, actually, I'm sure you know about Dr. Robert Cathcart back in the 70s, 80s. He's done research on that. Basically, there's a Cathcart theory. Basically, in the normal people, when you take vitamin C orally, you take anywhere probably 5, 10, 15 grams, you would have diarrhea. But for somebody who's severely sick, you can take up to 100 to 200 grams without diarrhea. Why is that? Of course, it's a not direct, it's an indirect evidence to support that your body is very deficient of vitamin C. And so actually coming back to this is that most of people today don't have that 70 micromolar vitamin C plasma concentration you mentioned. And most of them have probably in their teens or 20s, okay, some people in the single digit. If we have 70, you're pretty good, you're pretty good. But for therapeutic treatment, oftentimes vitamin C for like hydrogen peroxide production for cancer killing, you probably need a vitamin C to be in the millimole level, which is at least one or two magnitude higher. And that higher level can only be achieved via IV vitamin C, maybe liposomal vitamin C. Liposomal, and these pharmacokinetics studies show can achieve much higher than oral vitamin C. but not as high as IV. But not enough studies have been done. Liposomal simply is also another oral form of vitamin C. That's the vitamin C. Vitamin C is water soluble. Our gut lining, our intestinal lining is lipids soluble. Is made of fatty cells, and so vitamin C is hard to absorb. And this is for the audience. So when you wrap these vitamin C molecules in a lipid layer by layer, like a normal cells, then these vitamin C can be absorbed much more significantly.
Right.
Yeah.
Now, earlier you mentioned that the role of vitamin C as an antioxidant, because it seems that viral infections increase oxidative stress in human bodies. Now, vitamin C, as we know, is an antioxidant, so that any effect of vitamin C may be most prominent under conditions when oxidative stress is elevated. Sorry. Now,
Yes.
many infections lead to the activation of phagocytes, which release oxidizing agents referred to as reactive oxygen species. Now, these play a role in the processes that lead to the deactivation of viruses and the killing of bacteria. However, many of these reactive oxygen species appear to be harmful to the host cells, and in some cases, they seem to play a role in the pathogenesis of infections. So, how do you see vitamin C play a role in protecting host cells in the human body?
Yeah, you actually touched on a very important point. COVID-19 and the SARS of what the 13, 17 years ago, and the MERS, the Middle East, MERS infection, all of these coronavirus infections have one thing in common, which is the ARDS, the acute respiratory distress syndrome, which has a much higher mortality. So basically that leads to death. ARDS, that's why people can't, that's how people cannot exchange oxygen through the lungs, and they get choked to death. That's why these people need to be put on ECMO machine. ECMO is basically iron lung, the outside of a body, breathing machine for the human beings. And ARDS research in the past and also this time shows that these patients almost always have a so-called cytokine storm. Just as you said, the viral infection triggered a cascade of reactions that caused a lot of free radical, so-called cytokine storm. A lot of free radicals to be released into the system and overwhelming the system's antioxidants. And so our defense system is not only killing the virus, which is good, but at the same time, it's also as a friendly fire, killing our own or damaging our own normal cells. Yes. This is actually, if the patient didn't develop the ARDS or the cytokine storm, those people probably will be able to recover from the COVID-19. After all, most of the people will recover from it. Very few, small percentage of patients. Right now we see numbers from anywhere from 0.3, 0.5% to maybe as high as 5%, given the conditions. So the vast majority of people will recover. So yes, to answer your question, here vitamin C is an antioxidant. And that helps, particularly in large doses, that you have to use a lot of vitamin C to neutralize these free radicals and help to calm down the cytokine storm, to reduce or prevent or repair the damage by these free radicals to our normal cells. And that's very important.
I think there is also evidence that plasma leukocyte and urinary vitamin C levels decreasing when we get common cold or influenza virus and in other viral infections. So Human Wares in 1973 reported that vitamin C levels in leukocytes have they halved when subjects contracted a cold and returned to the original level 1 week after recovery. So vitamin C levels are also decreased by pneumonia. So since there is a decrease in vitamin C levels during various infections, it probably implies that vitamin C administration might have a treatment effect, therapeutic effect on many patients with infections. So we can probably take a similar approach with this COVID-19 coronavirus, that is COVID-19.
Yes, actually, you're absolutely correct. Is that vitamin C in our body cells, not all our body parts have the same level of vitamin C. leukocytes, the white blood cells, our defense cells, have one of the highest concentration of vitamin C. Why is that? We have to think about, right? Why the white blood cells have more vitamin C in themselves more than the other parts of the body? Why? Here, that's another piece of evidence supporting vitamin C's anti-inflammation capacity. Why? Because we know whenever there's infection, right, the white blood cells are attracted to the infected site. So it carries with it the white vitamin C. Yeah, that's that. And also, let's review some literature. Let's talk about what has been done in the past, what we know about vitamin C and the virus infection, other than what we mentioned. Let me quote two. I think these two studies may be more relevant to our audience, to us as the general public. I'm talking about oral vitamin C. I will talk about IVC a little bit later, but let's talk about oral, because high dose vitamin C by mouth can prevent viral infection. This year, not long ago, there's a study coming out of Korea, reported in British Medical Journal Military Medicine, BMJ Military Medicine. And that's a study of, I just finished a manuscript today, so I remember the number, 1,444 military recruits in a 30-day training camp in Korea, South Korea. And these many people, that's a large number, over 1,400. They were divided into two groups. One group, roughly half-half. One group of taking vitamin C as a prevention, and they take high doses. Again, the studies in the past of some number of studies didn't show effectiveness because those were too low. Dose is always important. When we use drugs, we have to always use right drugs. When we use vitamin C, the same thing applies here. We need to use sufficient amount of the dosage. So the one group of the South Korean military recruits were taking 6 grams, that's 6,000 milligrams of vitamin C a day. The largest dose of vitamin C tablets in the United States you can buy from Sam's, Walmart, is 1 gram. That's 1,000 milligrams. Basically, that's 6 tablets. That's high dose. I take 10, okay, by the way. I've been taking 10 for quite a few years. So these patients, these military recruits who were taking 6 grams of vitamin C a day, 1 month later, compared to the group that didn't take the vitamin C, they had 0.8% less chances of getting a cold. Basically, they have 80% chances of getting cold compared to 100% of people getting cold. Okay, this is significant. So here we know high dose of vitamin C can prevent people from getting common cold viral infection. Now earlier, 1999, there was another study by a Swedish, I think it was Swiss group. Basically, these were about 460 some students, nearly 500, 460 some, aged 18 to 32. They were divided roughly into 2 groups. Now, so whenever these students develop symptoms of a cold, they would be given vitamin C. How much would they give? They would be receiving 1,000 milligram vitamin C every hour for the first 6 hours. So basically 1 gram per hour for a total of 6 grams for the first 6 hours, and then 1 gram 3 times a day. Now, compared to the control group who didn't receive vitamin C, basically when the control group patients, when they show symptoms, again, here we're talking about treatments. The earlier study I quoted was about prevention. So the control group, if they develop symptoms, they would be given like a pain relievers and nasal decongestants, like we usually do. Now, after, upon the conclusion, the authors of study concluded that actually the vitamin C group had 85% reduction in symptoms. We're talking about 85%. So there are many other studies, but let me just quote 2. why I found this particularly more interesting is because we're all focused on severe, moderate, severe cases of COVID patients, but most of us are not in that group. I guess most of the audience that listen to you are average people. We are more concerned how can we protect ourselves from getting this. My message to your audience is, well, take a lot of vitamin C like I do. I would suggest that for you, for average people out there, at least take like 5 grams a day. You can divide 5 grams or 5,000 milligrams of vitamin C divided into 2-3 doses. I take 10. If you want to take 10, that's even better. I usually advise people take powder because when you take too many tablets, they can hurt their stomach. Powder is usually more pure. And so dividing a couple of, 5 to 10 grams a day, divided into 2-3 doses if you are normal. Now, if anybody who gets sick, any sort of like viral infection, cold, symptoms like that, whether it's COVID-19 or not, it doesn't really matter. Just do like that Swiss group did. Take 1 gram every hour I would go for as long as your symptoms exist. Why do I ask you to take every hour? Is because vitamin C absorption will decrease when you pass that 1 gram level. Usually we can absorb nearly 100% of 1 gram of vitamin C orally. And if you take, for example, if you take 3 grams, on average, you may be able to absorb only about 1 gram. The other 2 will stay in the GI tract. Okay, so in order to maximize our GI absorption of vitamin C, we advise you take hourly. 1 gram, 2 grams per hour, and every hour. And actually, usually, oftentimes I tell my friends or my patients, my family members, usually I will load myself. If something happens, you load yourself with 5 to 10 grams, then followed up by 1 gram per hour. You know what? Whether it's UTI, urinary tract infection, whether it's upper respiratory infection, or even you had some bad in the food, you had just bad foods, spoiled foods, you have a GI problem, take a lot of vitamin C. And if oftentimes I ask them to take vitamin C to the degree of having a diarrhea. We call that vitamin C flush. Why? Because too much vitamin C will cause that osmolarity. Basically, it will cause a diarrhea, watery diarrhea. That will carry away, excrete the toxins, potential toxins or bad foods in your stomach, in your gut. So that's for the average people. And I believe, actually, I should tell the story. Did you read the story on my YouTube video? Actually, YouTube took it down.
Yes, I saw your YouTube video, and that's how I came to know about you. So thank you.
Okay.
But I would like you to share that story, analysis and story.
Okay. Well, this is an interesting story. Let me tell the group. Basically, like I said, as the epidemic broke out, me and a group of doctors here were promoting vitamin C. Well, actually, vitamin C content went all over the world, went to the highest level here, medical group in the country. So somebody started, giving me feedback, and that's why I've been swamped lately for the last 2 months. I've been super busy. Anyway, there was a story coming out saying that there was a family in Wuhan who were protected from vitamin C. And I said, well, I need to talk to this person because I'm a scientist, I'm a doctor, I don't spread rumors. I need to verify the best I can do. So what I could do best is I tracked her down. This is a lady in Wuhan. I talked to her over the phone, and that's all I have, okay? Hope she's telling me the truth. I don't have a reason to believe otherwise. Well, basically, this is a family of 6 in Wuhan. Grandparents in their early 70s, and Mr. N, Nunu is her name, Nunu and her daughter, teenage daughter, and Nunu's brother and the brother's wife. That's 6 member. And they are a very tight family. They visit each other regularly. They live in the neighborhood. And so around the January 20th, and grandma came down with cold symptoms. And that's when this epidemic became public. Nunu knew about nutrition. She had learned about vitamin C. So she immediately started taking and advised everybody in the family take a lot of vitamin C. She herself was taking about 10 to 20 grams a day. And she also told the grandma, take a lot of vitamin C. The grandma didn't really trust her. And so we estimated it. Me and I spent about 1 hour with her trying to figure out a little bit more details, right? Because as a doctor, you need to be exact, you know. And so anyway, we figured that maybe the grandma was taking maybe 5 grams a day. She didn't take the whole dosage. So actually the grandma was, running a low-grade fever, a little bit upper respiratory symptom like a cough, kind of not herself entirely, but not too bad. This went on for about 10 days. And the condition didn't really worsen, but didn't recover either, okay? And the rest of the family, none of the rest of the family contracted the virus infection by this time. And actually early on, for the first few days, nobody took any protective measure. Nobody were, at home, who wears a mask, right? And nobody wore, gloves and that kind of thing. Anyway, 10 days later, about the end of January, the grandma went to the hospital to check out, and they confirmed her was COVID-19 infection, known as COVID-19 now. She was admitted to the hospital, and the condition began to deteriorate. And New then, at that time, she didn't have access to vitamin C. And so New talked to it's about maybe about February 10th-ish, and about 10 days after she was admitted. Her mother condition deteriorated. She was admitted to the ICU, and she was unconscious for a little while. And she was put on ECMO, I think. Yeah, she was put on ECMO. And New talked to the intensive care chief. At this time, the first IVC clinical trial study went public. So she took the news report to the ICU chief. She said, look, they are willing to give large dose IVC. Please give my mom vitamin C. I give you the authority, I beg you. Anyway, the doctor gave her 10 grams. She said, I couldn't give you more, Here, the doctors are willing to give like 2 to 3. And usually above 2 to 3, they become very nervous. Very few doctors were willing to do that. And I have been able, actually I've been promoting vitamin C in China for the last 5-6 years. And there are a few hospitals and doctors are willing to do that, not many. Anyway, so the grandma was receiving 10 grams a day, and she was stabilized and actually improved, went off ECMO, and was discharged to regular ward she was in ICU for about 10 days. And so during this whole period of time, New and her brother and the sister-in-law, 3 of them, the 3 adults, were taking turn to take care of the mother. And they didn't have a lot of protection. They didn't have like the spacesuit kind of thing. They will only wear masks and gloves. But nobody contracted the virus. The entire medical staff were very surprised. And, they didn't contract any disease. And of course, we cannot draw any conclusion, but that's the story. That is the story. Again, remember, the grandma is a diabetic and has coronary heart disease with a stent placed. So, and she has other, GI problems. She is a chronic disease. She's in the group of high risk of mortality. And she didn't. She survived.
Yes, that is.
Can you hear me?
Yes, absolutely. That is amazing. I mean, it seems that vitamin C is safe. I mean, it's found in nature, and it's not toxic, so it's safe, and it costs only pennies per gram. And I think if we apply that, if we take the dosage that is necessary to protect our body, then even modest effects of vitamin C may be worth exploring, especially in this crisis when so many people are dying across nations. So what would you like to tell? I mean, that story that you told from that Wuhan family, I'm really glad that, they took vitamin C, and I'm really glad that they survived this and, nothing happened. But there are so many people at risk across nations, and so many people, it's not even the old people that are dying, the young are also dying. Thank you, Dr. Cheng, for participating in Risk Roundup today. We appreciate your thoughtful insight on benefits of vitamin C on coronavirus, the ongoing COVID-19 pandemic crisis. Our global viewers and listeners would benefit tremendously from the information you provided today. And even if a single nation or single individual is able to understand the importance of incorporating vitamin C in their preventive and therapeutic approach to manage the current crisis, after listening to this discussion, this Roundup dialogue has been of service, and we thank you for that. Risk Group is a strategic security risk research platform and community. Our ecosystem is the first and only cross-disciplinary and collective community that is made of top scientists, security professionals, thought leaders, entrepreneurs, philanthropists, policymakers, and academic institutions from across nations collaborating to research, review, rate, and report strategic security risks to protect the future of humanity. Add your voice to risk groups. Until next time, I'm Jayshree, host of Risk Roundup, signing off. See you next time. Thank you.